Good afternoon, everyone. Thank you for joining today. Happy Friday. My name is Claire Paprocki, and I am the Public Information Officer for Brown County Public Health. We have two guests joining us today. We have Brown County Executive Troy Streckenbach, as well as Purveya President and CEO Dr. Ashok Rai, who will provide us with an update on community testing results, and then we'll talk about the transition from community testing back to the healthcare systems. So first, I will give you a report of the numbers. Today, Brown County is reporting 2,188 confirmed cases. Oneida Nation is reporting out 32, for a total of 2,220. We currently have 28 individuals who are hospitalized, and we're happy to report that we have 768 individuals who are out of isolation. Yesterday at the Rush Center, we were able to conduct 460 tests. At Casa Alba, we tested 188 individuals for a total of 648. So far, between the two testing sites, since we opened them, we have tested 12,247 individuals. Lastly, unfortunately, we had another death reported to us. This was an 89-year-old female from the zip code 54162. We'll now turn it over to County Executive Streckenbach.
Thank you, Claire. I appreciate the update. And as always, we're always saddened to hear of the passing of another resident of the community. Thoughts and prayers to the families. As we're kind of embarking in this journey that our community in our state and our nation have been going through, we realize that standing alone, you feel alone. And when you're with others, and when you have collaboration, when you have community partnerships, having that group of people with you to help you through some of these more challenging times is certainly helpful. It's comforting, and most importantly, when you're trying to make tough decisions on how to navigate rough waters, it's always easier to do it when you have the expertise and professional advice of, of course, our public health, the state Department of Human Services, and of course our healthcare providers. So I'm looking forward to hearing some of the updates from Dr. Rai in terms of the overall testing and what it tells us about what's happening in our community. Before we get into that, I just want to kind of talk about our journey up to this point. We began in terms of the earlier part of March, wondering if and when it may arrive here in Brown County. We then realized in the early part of April that it did arrive. And with that, we mobilized with partnerships of our healthcare providers, National Guard, DHS, the state of Wisconsin, all came together to help us mobilize and put in place on-site testing for our employers, where we were seeing a large concentration of positive testing, and at the same time then mobilize the community test sites. The community test sites initially were being used for family members of the communities that are the family members and the workers at those places of employment. Then it was decided to allow for those test sites to then allow for Brown County and individuals who work in Brown County that were symptomatic to get the test. And then we transitioned to the asymptomatic testing for anyone who lives in or works in Brown County. And from that, we heard Claire talk about the sampling size of 12,000 residents in Brown County. And, I look forward to hearing what Dr. Rai has to tell us about what that sample means in terms of that And hopefully it gives us a better, as you heard us talk about in the past, about why the testing is so important. One, we need to be able to identify, trace, and get a control of an outbreak. And at the same time, we have to understand how prevalent it is within our community. Are there a lot of people who are asymptomatic who are walking around our county that actually have the virus, and are they passing it on to others? This is kind of a critical piece as we talk about in as we are reopening. As we saw at the last town hall meeting, and give a lot of credit to Ted Shove from Brown County Public Health, who's the manager and head sanitarian at the health department. He put together a town hall meeting going through, and it was a 4.5 hour meeting where, at one point in time, I know we're well over 200 participants, but talking about what individual businesses can do to create confidence, not only with their employees, because you need the workforce to be able to work in order to sell a product, but also to give confidence to the public. I think we just saw a study that said 70% of the public is still concerned about, re-energizing the economy, going back out, socializing the way we did pre-March. And I think part of their ability to have some level of normalcy is knowing that we as businesses and government and nonprofits are reopening and taking a lot of consideration. So part of our plan here is, of course, making sure that we, one, have a better understanding of what's happening in our community, and Dr. Rye is going to give us some information on that. And then the second part is we kind of begin to reopen is what precautions are businesses doing to make sure that, one, we're not creating another outbreak, that we're not increasing the ability for the spread to take place. Because right now, until this pandemic is over or we have a better grasp on how this virus operates, we're still in the middle of it. We're not through the woods. We still have a lot of work ahead of us, but we can get back to some level of normalcy and get back with our lives and get people back to work and get us, getting people with, an income so they can pay their bills. And in order for us to do that successfully, we need to do it in a manner that protects all of us. And so afterwards, I'm going to kind of talk about what we're going to be looking at doing next week with Brown County's reopening plan and the guidelines that have been created by Ted Shove and his team. And I think this is the second phase as we go forward. But in order for us to do that, we have to understand the science. We have to understand, what is actually taking place in our community with regards to this virus. And to speak more about that has been one of our, community partners that we've been relying on heavily to help give guidance in addition to Prevea with Dr. Rye. We've also had Aurora and Bellin working collaboratively with us in terms of better understanding how the county should mobilize and react to the situation. And again, for most people, if you're not aware, each healthcare providers have been providing staff at each one of the 2 community test sites to, allow for this massive testing to take place. And as they reopen their services, it's important for them to be able to get their staff back on site so that they can provide some of the elective care that's been postponed. And as we've seen, the marketing or basically the call outs to make sure that the public comes in and gets some of that care taking place, because postponing it too long could actually have a health detriment to the individual. So with that, I'm going to turn it over to Dr. Rye, who's going to give us better insight on the overall community testing and some of the results. Dr. Rye, thank you for joining us.
Thank you, Troy. I appreciate that. So I'm going to try to break down the data the best I can for you, and I'm going to try to talk slow, which is not my normal. Because I know media was going to want to actually record the numbers. So I'm going to break it down by each site that we participated in testing. So the way that this worked, just to remind everybody, is the National Guard came in, brought the Exact Sciences test, but all of it was put into the Prevea EMR so we could do callbacks and also, work through the positive patients as well as be able to report some data back to you. So I'll start with the Casa Alba site. And this data is as of this morning. We continue to get results back because, as you know, there's a delay between the time a swab is done to get to Madison, and then the lab having a few days to run that, and then the result getting back to us. So hence a little bit of delay in the numbers. But so far, we've had 3,738 results back from the Casa Alba site. 175 of those have been positive, creating a 4.7% positive rate. And it's important to remember that Casa Alba has been open less days, so it has had less tests reported back. The Rush Center site, we had 6,662 tests back. 244 of them were positive, with a positive percentage over total being 3.7%. In aggregate, that would be 419 total positives of 10,400 results that we've received, or Brown County snapshot of 4% being positive. We have also plotted this out over a 14-day time period. It's important to know in that 14-day time period, not every site was open. Remember, Casa Alba and the rest are closed on Sunday, and then Casa Alba had one day not being open because of weather. So we've kind of had to adjust for that. But the downward slope of positives per day is pretty significant. It's actually statistically significant. And for those who actually want to record this, the p-value for both has been less than 0.05. So we've definitely seen that trend down of a percentage of positives over the total. In this process, we also partnered with public health and did community surveillance, basically looking at patients who did not display symptoms when they were tested. So they're either asymptomatic or what we call pre-symptomatic. This data actually includes everybody that came in that did not have a symptom at both Casa Alba and the Resch, and also has a few hundred patients that we did some long-term care surveillance on, and it's all mixed together in that. So of the asymptomatic people, or the people that did not record a symptom, 110 of them were positive. That's 6,666, so 6,766 that basically came in at some point and said they did not have a symptom. So 110 of them are positive, 1.6%. So if you look at that, 110 positives over 10,883 total tests back out of that pool, so it's about a 1% asymptomatic rate of the snapshot we've been able to do, including the testing sites and some of the long-term care that we've been involved in. So as we look at this, where we began with the outbreaks going at the different manufacturers, and the strategy was to test that population that was symptomatic right away, and then test their families, and then test other exposures, then look at the community that had symptoms, and then do surveillance testing amongst the community of people without symptoms. We can definitely see a nice negative trend in our percentage of positives. The prevalence of the disease is still here in Brown County. We don't want to say it's gone, but the prevalence of it is lower. And it's shown that statistically significant downward trend that, say, if we were still looking at the Badger Bounce Back Plan, which is now defunct, but at any phase-in plan. So if we take the federal phase-in plan, the state phase-in plan, we would be solidly in that phase one and actually already looking at the next phases. Follow the WEDC guidelines and the CDC guidelines for businesses opening up. From a healthcare perspective, at least from my perspective, it would be, appropriate for us to be in those phases and looking at continuing to ramp up as we go forward. Still following safe guidelines, as the county executive said, making sure that we're doing the right thing and making sure that the companies are doing the right thing, and they are following those guidelines, and as we continue to get back to work here in Brown County. So as we look at the data as a whole, it's been a great partnership amongst everybody involved. Next week, hopefully we'll have all the final results in, and we'll be able to break this down for you once more. Turn it over back to the county executive. Oh, I was supposed to comment on one more thing. Sorry, Troy. The other thing I was supposed to comment on is testing going forward doesn't end here. The community testing sites, obviously stopped today, this evening. Going forward, though, if you have symptoms, or if you don't have symptoms but exposed to somebody with COVID-19, you can still go to a health care provider and get tested. All three healthcare providers are providing testing, and you can go to our individual websites for those instructions and we'll continue to market that to the community as well.
Okay, thank you, Dr. Rye, for that stats. And I think it's, when we think about, when this started on, and when you were seeing what happened in China, and you saw what was happening in Italy, and then you saw it come onto our shores in New York and in Washington, I think a lot of people were scared and, quite frankly, just unsure about how safe was it to leave our house. And what was really important, and again, I give a lot of credit to the National Guard, the state, the governor's office for allowing us to do that asymptomatic testing, which originally, would have was not part of the overall testing that was made available in the beginning stages. It was prioritized because of limited resources to that, a special group in tier 1. And so that, because it was allowed for us to do asymptomatic, I think we were able to get a good sampling of what is really prevalent in our community. And to hear that of that sample that we have 1.6% positive out of the asymptomatic, that gives us somewhat of a reassurance that testing asymptomatic at this point in time doesn't make sense, and that we should continue to do the symptomatic low bar. So if you have one of those many symptoms, if you just have one of them, you can request a test from your healthcare provider, and they should be able to provide that for you. One of the things that needs to be stated is, as going forward, of course, because testing's not going away, we still have testing available. It's going to be provided by the healthcare providers. And if you don't have insurance and you're concerned about where you can go, the new community clinic here in downtown Green Bay, of course, is providing testing, it has testing available for those individuals as well. And so testing is available in Brown County no matter what. It's just transitioning from the community test sites where we're doing heavy asymptomatic testing and now going to the healthcare providers to do symptomatic testing, where ultimately that's where, if you have a symptom, you go to your doctor. And so it's great to see the numbers. I'm glad to hear that we have a downward trend that tells me that the public in Brown County is taking this situation serious. We are taking the appropriate, yesterday I had to stop at a store to get something, and I was glad to see people wearing masks. Again, we know masks don't protect you from getting it. It protects you from giving it to somebody else. It was good to see the business had social distancing put in place. It was nice to see them have plexiglass to support their, the workers in this type of environment where it was more of a warehousing type of situation. So needless to say, it was good to see. As we're coming onto the weekend, of course, we're celebrating Memorial Weekend. And, obviously there were men and women who dedicated their lives, sacrificed it, quite frankly, for the ability for us to have a free society. And we're seeing that coming out in debate today, right here in the state of Wisconsin in the United States. And I would just encourage, because, as we know, things are changing, and in terms of how we, gather as a public, especially right now in terms of just we're getting out of the woods. We have some positive feedback in terms of the numbers. We see a downward trend. So it just means that businesses, the public, are taking these things serious, and we shouldn't stop. We should continue to do that until we know for surely we're in a safe spot. So this weekend, it shouldn't stop us, though, from really celebrating Memorial Day and taking a moment in time to show respect for the men and women who sacrificed their lives to give us this freedom. And on Monday at 4 o'clock virtually, you can watch the United Patriotic Society perform their annual memorial service at Brown County Veterans Office Facebook site. So if you want to watch that virtually, we'll have it available. United Patriotic Society will continue to have their annual memorial service on Memorial Day at 4 p.m. And so we just encourage you to take some time and reflect and recognize the sacrifices that men and women have made and what this weekend's really truly about. And at that, I'm going to turn it over to Claire to give us a brief on what to expect going forward. I know that there's something that Claire didn't have in her notes, and that was next week we are going to be holding an additional media brief to showcase or at least go over, as we found out when meeting with local industry business owners and community leaders, the need for a localized guide and plan for reopening became more prevalent over and above the CDC, WDC guidelines. And so on Tuesday, we will be unveiling that plan and providing businesses with some tools to help them successfully reopen with confidence. And with that, Claire, I'm turning it over to you.
Thank you, County Executive. So before we go to Q&A, I just want to make a couple statements and share a couple thoughts. Like County Executive Streckenbach said, this is a holiday weekend, and with the safer at home order no longer in effect, we know people want to get out there and celebrate. They want to gather. They want to go to their cabins, restaurants, parks, etc. And in public health, we've been receiving a lot of questions about whether or not it's safe to go out or what people should be doing. So there's lots of confusion, and there's no absolute guidelines or rules in effect, so we can only make recommendations at this point. The main thing we want to stress is that even though the restrictions are no longer in place, COVID-19 has not gone away. We urge everyone in the community to remain vigilant. We have to rely on people to use common sense and to think of others when deciding what they should or should not do going forward. The idea of being safe is not black or white. There's the COVID-19, the spread of it in our community is influenced by multiple factors. So our guidance and our recommendations are to continue to practice social distancing, limit your gatherings to 10 people or less, wear a mask in public, like County Executive Streckenbach said, wash your hands frequently and thoroughly for at least 20 seconds or longer, and continue to visit the CDC, DHS, WEDC websites for the latest updates and recommendations. Like County Executive Streckenbach said, next week we will host our media briefings on Tuesday and Thursday at noon. Each day that we don't have a briefing, we will send you the numbers around the same time, with the exception of Monday, as that is a holiday. After next week, we will start deferring folks to the DHS website, as they will have the most accurate data and numbers to report out. Any future questions, though, can be directed to County Executive Streckenbach or myself. So with that, we'll open it up for question and answers. As always, please, if you could introduce yourself and the outlet you're reporting from and who the question is directed to.
This is Haley with the Press Gazette. I just want to clarify a couple of the points that Dr. Rye made. So you said that this decline that we've been seeing has been over the last couple of weeks overall.
Yes. Can you hear me?
Yep.
Yep. Yeah, my answer is yes. The decline has been over the last 14 days. We've been continuously plot out in a 14-day block.
This is John Duran from WLUK for Troy. Now, the National Guard and the people who operated those community test sites are gone, but will they, I know it's two different setups between the Resch and Casa Alta, but will they, for the most part, be set up or easy to set up if in case you need to use community testing again, or do you see having to, if there's another outbreak, use community testing again?
So the one thing that we do know through this process was that we are able to, in rapid fire, able to put up a community test site in less than 24 hours. So that's number one. Number two, which has been the bigger debate and the bigger challenge, has been where are we getting the assets, the resources to run this? As you guys are aware, Brown County is not a healthcare provider. We are not doctors, and it's critical for us to be able to have the support in order to run these community test sites. And so as what is going to be important, of course, is the ability for the National Guard to be able to remobilize in an area where there is an outbreak. Now, we realize that the National Guard is doing services throughout the state of Wisconsin. We have 72 different counties, and their ability to do that effectively is going to be able, they need to be able to be mobile. So from our perspective right now, we know that we can have a site brought up and constructed within 24 hours. Our goal, of course, is that if we do require a new community test site, that, honestly, right now, I believe I heard Dr. Rye mention at one point that he believes the healthcare could manage roughly for symptomatic, not asymptomatic, because asymptomatic puts it in a whole complete different perspective as far as volume of testing. But for symptomatic testing, they should be able to manage the current load that is here. If we have a major outbreak within a place of business, I think we would deploy to that location with the healthcare providers being the partner in it. But if necessary, we, just like how we did it this time, there's a work through process that requires our EOC, and as you guys saw, Brown County reissued the local emergency relation, which allows for our emergency operations command to be open. Having that open allows us then to make a request up to the state EOC, and that's where we would then ask for DHS and the National Guard to come on site. As everything, anytime you are, there is a process, John, to all of that, but from what we've seen in terms of the deployments and how fast we were able to get things done, I'm confident that if we have another outbreak, we will be able to bring the necessary resources together to mobilize.
Rob Sussman, AQ. My question is about antibody testing. Has there been any discussion about possibly getting antibody testing in Brown County?
Yeah, go ahead, Dr. Rye.
Antibody testing is available in Brown County. We'll be able to actually start placing those orders next week, but I think it's really important to understand the why behind that. Antibody testing really only tells you that you've been exposed to COVID-19, does not confer immunity. So a positive test does not mean you're immune. A negative test does not mean you don't have COVID, because you could have COVID and not have developed the antibodies yet. Depends on where in that life cycle of that viral infection you are. So antibody testing to people will be available. That's reimbursed through insurance per CMS rules. I think that rule came out 2 weeks ago. We are actively working with the Red Cross and the different companies that accept plasma to see if they will take an antibody test without a positive COVID test, the traditional COVID test for plasma donations. So there may be a role coming up here in Brown County for more robust antibody testing around that. But right now, I just want to remind everybody that antibody testing only tells you you've been exposed to COVID-19. That's it.
I had another question for Dr. Rye regarding the downward slope. I know you had mentioned the p-value before, but I mean, when you talk about a statistically significant downward slope, I mean, how downward are we talking here?
I can actually give you, well, the p-value tells you how downward you're talking about. Casa Alba, I think, was 0.000 and Resch was 0.003. So significantly less than 0.05. So that would be a significant, statistically significant downward slope.
Any other questions for Dr. Rye, County Executive Streckenbach, or myself?
I just have one more, John Duran. It doesn't seem, this is for county executive, I believe. It doesn't seem like people are really, bars or restaurants are really packing their establishments. Although I don't think I could be wrong, but I don't think there's anything legally keeping them from doing that. They're pretty, seems like respecting the CDC guidelines. Is that encouraging to you that people aren't, going against that? And then also, is it kind of a good opportunity to show, as a county or as a state, that with things wide open, we have an opportunity to maybe show the country, with a state that has no restrictions, we can do this safely and open, get people back to work and get the economy back?
So I would just answer it this way, that number one, the initial request was not, I can say that the industry leaders, the people who represent some of the businesses, were very active in contacting public health for advice, guidance, because I think every business owner is equally concerned about, wanting to open up safely for the purposes of, one, revenue to help their businesses out and, pay bills, and then two, do it in a manner that's safe. And so they were looking for guidance. And I was very pleased to hear that our public health was getting contacted by a lot of representatives who were looking to do the right thing. And so from that standpoint, we may have a few outliers, but I know that just from seeing what I saw on social media, for those businesses who took the time to explain to their followers what they were planning on doing as far as when they were going to open up, and then secondly, how they were going to open up, the fact that the overwhelming majority of people were extremely appreciative of that, because again, you got to remember, there's polls out there that say that 70% of our population still doesn't feel comfortable resuming life as normal. And so anytime a business can give that customer or that patron the reassurance that they're taking every precaution they can to make sure that they're safe when they come in to patronize them, that only gives us the ability to get some sense of normalcy and have our economy reopen. I think we've all seen the stories on the news about businesses not reopening. That is just a travesty, and it's extremely unfortunate. And as I've said in the past, 80% of our economy relies on small businesses to be able to operate. And so I think the two are critically important. I would hope that, in the eyes of the healthcare providers, that, from their perspective, the businesses, the residents of Brown County, Northeast Wisconsin, have done a good job in terms of managing this. The reality is, though, we can't accept this as being that we're at the finish line. We're not there yet. And so we have to be, as Claire mentioned, continuously be vigilant in terms of how we conduct ourselves in public. So when we decided that we're going to go out and patronize a business, what are they doing? How are they communicating to you, the resident, the customer, well, how they're going to make sure that you're safe when you come into their establishment? If they're not doing that, then you might want to second guess about whether or not you want to patronize them. So from that standpoint, John, I think overall, I think the county's done, everything it possibly can to try to manage the situation that we're in, realizing that we are the second highest in the state of Wisconsin in terms of positive cases. So that shouldn't be taken lightly in terms of what it represents. But I think the way that our communities reacted and how we, brought together the collaboration between our healthcare providers, DHS, the National Guard, the governor's office, all mobilizing, working together to get a better handle on it, and then do that wider testing, as Dr. Wright kind of explained, in terms of what the asymptomatic testing, 1.6%, and then the overall, the overall symptomatic or overall positive rate is 4%. That is a positive thing, I guess, in terms of managing this virus. And the fact that we have a downward trend, that's critical. So for all intents and purposes right now, John, I think businesses, the residents, everybody's still cautiously, managing this, and we are doing it in a manner that allows us to move forward.
Rob Sussman.
Thank you.
The numbers that we're seeing right now, Claire, they are from after the end of the safer at home order, yeah?
I'm sorry, could you repeat the question?
Yeah, the numbers that we're seeing right now, the numbers that are being reported today, those are numbers that are coming from people who were tested after the end of the county's safer at home order. Is that correct?
Yeah, I think that would be safe to say.
The numbers include people from after the order was there, but it also includes numbers of people before that who was lifted as well.
And then I had one more question for Claire. Out of isolation, is it fair to say that people who are out of isolation have recovered?
I might actually punt that question to Dr. Rye. We consider out of isolation, someone who's not displaying symptoms anymore and are able to go back to work or normal, quote unquote, normal life. But I don't know, Dr. Rye, if you have thoughts on that.
So we use a CDC recommendation for out of isolation. So it has to be 10 days after the first symptom with 3 days in a row towards the end of that without any fever and a significant decrease in the respiratory symptoms. Now, that being said, that's what we've learned over this time. That recommendation has actually changed twice since we began this. So understand we learn something new every day, but today we would consider somebody, quote, recovered, end quote, when it's 10 days past the first symptom, 3 days in a row with no fever, or in a significant decrease in respiratory symptoms. It's also important to know that somebody can continuously test positive after that time period because there is still what we call viral shedding in that situation, maybe not infectious, but once again, still testing positive.
So it wouldn't be unfair to use those terms synonymously?
Which two terms?
Out of isolation and recovery. I know that the state has been reporting recovery data, but not isolation.
I think at this point, at least from a medical standpoint, if those terms were met, the 10 days and you're out of isolation, yes, we would consider that recovered.
Thank you.
Any other questions for County Executive Streckenbach, Dr. Rye, or myself? All right, have a great weekend, everyone. Thank you for joining today.
Thank you.